All right. Hello and welcome everybody to the TEDS Data Dashboard webinar for the Overdose to Action peer-to-peer dashboard webinar series. My name is Sean Cleveland. I'm the Associate Director of Cyber Infrastructure at the University of Hawaiʻi System Information Technology Services. And I'm also a member of the Hawaiʻi Data Science Institute. Not co-presenting with me, but one of the individuals from our group that did a lot of work, the TEDS data set, and doing a lot of development on the dashboard is Jennifer Geis. So a lot of her work is going to be showcased in this talk here. So just a couple announcements and disclaimers here. So funding for this material was made possible by the Overdose to Action Cooperative Agreement from the CDC. Disclaimer, the views expressed do not necessarily reflect the official policies of the state or federal Department of Health and Human Services, nor does mention of trade names, commercial practices, or organizations imply endorsement by the US government. All right, so the webinar today, what we're going to cover is a little introduction just about our background, our team. Then we'll talk about what is TEDS, a little bit about the TEDS cookbook, as well as the limitations of the TED dataset. We'll talk a little bit about processing TEDS data, as well as walking through creating a dashboard using Power BI with the TEDS data set. And then we'll talk a little bit about some of the efforts using TEDS data for research, and then we'll wrap things up. So an introduction is who are we that is doing this webinar? Why are we qualified to talk about any of these things? So our team here, we're members of the Information Technology Services Cyber Infrastructure team at the University of Hawaiʻi. We service the entire 10 campus university system. We focus on a lot of things, especially things related to data and data science, as well as decision support. And so we are the driving workforce behind the Hawaiʻi Data Science Institute. So this is a list of our team here. As I said before, I'm the associate director. I do a lot of data science, data engineering, and research software development. And then some of the other folks on the team here, Jennifer Geis in particular, has been doing a lot of work with TEDS. Jared McLean, Jeff Wong, and Alan Singh are also some folks that are some of the data scientists and visualization folks that are on the group that have worked on data dashboards for this project. We don't do this alone, so we work with the Hawaiʻi Department of Health. So here's a list of folks from the Department of Health that drive some of the things on the DOH side. Amy Curtis in particular is the lead PI on the CDC OD2A grant here, along with Tiana and James have been doing a lot of work, and Tammy Smith has been doing a lot of support for us. On the University of Hawaiʻi side, Trina Becker is the UHPI on our OD2A dashboard stuff, and she's actually one of the people we'll talk about that's doing some research with some of the TEDS data. So a lot of folks did a lot of work to help support this. So if you are joining this webinar and you're not familiar with what OD2A means, it is the Overdose to Action. It is a CDC cooperative agreement aimed at expanding public health surveillance and allowing higher quality, more timely, and more comprehensive data collection for drug-related misuse and things related to overdose morbidity and mortality, trying to use data to drive prevention strategies. So if you want more information, there's a link that you can follow up with on the slides. A lot of the work that we discuss here related to TEDS is going to be reflected in our State of Hawaiʻi Behavioral Health Dashboard. So this is a dashboard that we've been working on. We rolled this out at the beginning of October. So we'll be incorporating a lot of the information that we're talking about here related to TEDS, and some of the dashboards will be coming into this dashboard here. All right, so now what is TEDS? So TEDS stands for the Treatment Episode Dataset. This is provided by the Substance Abuse and Mental Health Services Administration, so SAMHSA. This data is basically collected and reflects individuals that are undergoing substance abuse treatment, that are admitted and discharged for treatment multiple times. It is a system that comprises demographics and drug history information for these individuals. It is collected on a yearly basis, and you can find it at this link here. So there are two types of TEDS data sets. There's the admissions data set, and then there's the discharge data set. These two data sets, they are separable, but you can link the two together. And the data sets span for the admissions data set. You can go all the way back to 1992. And back in November, they just released the 2020 data set. So you can go from 1992 to 2020. And for the TEDS discharge data set, that began back in 2000. So what do these data sets encompass? So they have data about individuals. They're 12 years old or older. These are records for the admission or the discharge. So they are not individual people represented in these records. So an individual can be admitted multiple times, and there'll be a record of that admittance within this data set. So each of these records does not necessarily represent an individual. There's also demographic information contained within these TEDS data sets related to age, sex, race, ethnicity, employment status, as well as information about the substances that were detected, primary, secondary, tertiary substances are tracked. They track the age of first use of the substances, the routes of use, frequency of use. Also, there's a number of previous admissions related to this data set. So it's got some pretty comprehensive information in it. So where does this come from? So this information is compiled at the client level data for substance abuse treatment admissions from state agency data systems. So state systems collect data from these facilities that do these substance use treatment admissions or discharges. Many of the facilities, they report TEDS data, they receive state funds or federal block grants to provide alcohol and drug treatment services. So state law requires a lot of these programs to report into this system. So some states only collect data on publicly funded admissions. Other states, they collect on some private ones, but there's no guarantee. And then the states, they take this information and then they report it in a specific format to SAMHSA every year. So let's talk a little bit about the TEDS-A data set. So this is the admission data set. So there's two parts. There's a minimum data set, and then there's a supplemental data set. And I think we'll talk about the full encompassing data set here. So the minimum one is collected by most of the states at this point. It's about 19 items that include demographic information, primary, secondary, and tertiary substances, as well as their routes, administration, frequency of use, and age of first use, a source of referral to treatment, the number of prior treatment episodes, and then service types, including planned use of medication assistance or opioid therapies. And then there's also the supplemental information that includes 15 psychiatric and social and economic items in it. So if we look at, say, the TEDS admission data set, these are the different columns that we would find. These are the different fields that are being tracked here. There's about 62 variables that are in here, including the year of admission, case IDs, and things like that, as well as information about education. You can see substances 1 through 3 being primary, secondary, and tertiary. All of this information is captured in this data set. So as we're looking at the discharge, basically TEDS-A and TEDS-D, TEDS-D just has a couple additional fields that it's going to be capturing. So it's going to be capturing type of discharge, length of stay, and then also the reason for discharge or the discontinuation of service or treatment. So the TEDS cookbook here. So if you're interested in the TEDS data, I highly recommend that you take a look at the code book here. So the code book provides background for the TEDS files that have the data in them. This code book is very descriptive of all the variables. It also contains frequencies for the years that the code book is looking at within the data set. And then it also highlights some of the limitations of the data, which we'll kind of go through here as well. So there's a code book for each. There's a link to the TEDS-A code book for 2020. If you're looking for additional detailed information about what data each state reports and collects and how that maps to the national TEDS data that's getting reported, you can look at a crosswalk here. Just note that the crosswalks, they in no way map to the data sets that you'll get from TEDS. There's a lot of manipulation of the data that's reported in from the states that happens into the data set that you actually get back. So if you're wanting to work with the data, the code book is the document to take a look at. So one of the things the code book looks at here is the variables here. It does a really nice job of mapping the data that's stored within the data set. So all of the fields those 62 fields that I showed earlier, all the values within those fields are basically integer values for the most part. And they map to some sort of label. And so this code book will let you map the values that are going to be stored in the data that you can download to labels that you can actually do something with and derive, some analysis out of. So next, looking at the coverage here. So the TEDS attempts to include all admissions to providers receiving public funding. Because some state jurisdictions decide eligibility for what they report TEDS, it kind of depends. So there's no independent check happening outside of the state for the actual sources of funding. So it's up to the states who they're going to put in there. SAMHSA does request that states submit all data on admissions to any public treated facility. However, some state agencies are structured so that only clients treated with public funds are included in TEDS. So for the most part, TEDS is going to cover public funded agencies here. So several measures are taken to protect confidentiality for TEDS records. So the data that comes in from the states has, records about individuals, and there's a lot of different properties in there that somebody could, essentially use and be able to potentially go back and maybe identify an individual. So in the processing of TEDS, there's some top up or bottom down coding that happens to prevent some of these things. So for example, age is a variable that potentially on the bottom or the higher ends of things, or for age ranges where there are very few individuals, you might be able to use that information and some location information to extract individuals out of it. So for this reason, age is essentially recoded from the data that is submitted from the states into 11 categories for the public TEDS data set that comes out. So for example, the youngest category goes from 12 to 14, and then older individuals, we go with 65 and up for top coding things. Other information related to confidentiality, they do disclosure analysis to identify records that may remain unique after they do some manipulation. So routine measures are taken to protect confidentiality. Disclosure analysis is used to discern combinations of indirect identifiers that potentially leak an individual record, and records identified are classified as subject to disclosure. And they use a combination of 7 to 8 socio-demographic variables. So some of the other things they use is data swapping in order to satisfy the stringent confidentiality standards that need to be applied to these data sets when they're made public. They do apply some data swapping. This is the algorithm here. I won't really go into it. You can read some more about it through the slides, or actually the code book has a lot of information about it. So here's some of the things that they do with some of the data swapping to de-identify these records. The benefits here is the overall impact to the data is typically small. Nearly all of the data are left intact. The methods that they use don't have any more impact on groups like minorities or pregnant women than some of the other groups in the data. And the procedure typically doesn't affect any analytic use for the files. So the procedures allow greater detail to remain open to the public overall. For example, original ethnicity codes and things like that. So as we look at limitations of TEDS, so TEDS is a large and powerful data set. And like many data sets, you have to take care with interpreting the data beyond the limits of what you can, it's to applying it beyond the limits of what it's meant to do. So limitations, they fall into 2 categories. And so those related to the scope of the data collection system, and those related to difficulties in aggregating from highly diverse data collection systems. And so since these are aggregated from a lot of different providers and a lot of different state systems, that's some of the issues here. So looking at the limitations, so TEDS, it does comprise a large portion of admissions, but it does not include all admissions from treatment facilities. So just keep that in mind when you're using this information. It is not 100% comprehensive. It is a compilation of facility data from the state admin systems. And so the scope of facilities included, they're infected by different state licensures, certifications, accreditations, and disbursements. So for example, some states, the substance use agencies regulate private facilities and individual practitioners, while others do not. And in some states, hospital-based substance use treatment facilities are not licensed through the state substance use agency. So some substance use risk agencies track treatment in correctional facilities, such as states and local jails, while others don't. But in general, facilities reporting TEDS data receive state and or federal block grants for provisioning alcohol or drug treatment services, as we mentioned before. And I said most states are able to report all admissions to the eligible facilities, although some report only admissions financed by public funds. So they may not include any of the private funded providers. TEDS in general doesn't include data on facilities operated by federal agencies. So Bureau of Prisons, Department of Defense, Department of Veteran Affairs are typically not included. However, some facilities operated by Indian Health Services, they are included within the TEDS data set. And the primary goal of TEDS is to monitor the characteristic of treatment episodes for people with substance use disorder. Implicit in this concept is the treatment is a planned continuing treatment regime. Thus, TEDS does not include early intervention programs. So those are considered to be prevention, and so they're not included in the admissions or the discharges. Crisis intervention facilities such as sobering up stations and hospital emergency departments are also not included in TEDS. The number and client mix of TEDS records depends to some extent on external factors, including the availability of public funds. So for instance, in states with higher funding levels, a larger percentage of the substance use population may be admitted to treatment, including less severely impaired and less economically disadvantaged. So just keep in mind that funding can impact how many admissions there may be. The primary, secondary, and tertiary substances reported within TEDS are those substances that led to the treatment episode, and they don't necessarily encompass all of the drugs that may have been in the individual system or used at the time of admission. The ways an admission is defined may vary state to state. So if you're doing absolute number of admission comparisons across different states, it may not be valid depending on how those different states define an admission. Additionally, states continually review the quality of the data processing that they do. And as systemic errors are identified, they may revise some of the historical TEDS files. So this can improve the data set over time, but you need to double check the historical files. So as you're getting data out of TEDS, you may want to double check and see if there were any updates to some of the older data sets if you're doing comparisons across previous analysis that you used TEDS for. So they may update those files. I think this is the final bit on limitations here. States vary in the extent to which coercion plays a role in their referrals to treatment. So this variation derives from criminal justice practices and different concentrations of user populations. Public funding constraints may direct states to selectively target special populations. So you may see pregnant women or adolescents more represented in some of these things if they're more targeted examples. Many states submit records that include multiple admissions for the same client. As I mentioned before, any statistics derived from the data will represent admissions and not individual clients. So it's possible for individuals to have multiple initial admissions within states, and even within providers to have multiple treatment sites within the state. So if some states uniquely identify clients at the state level, others may not. So the state provides the TEDS provides a good national snapshot of what is seen at admission to treatment, but is currently unable to follow individual clients through a sequence of treatment episodes. So if you're trying to do that, you probably need to go to the state level information. And again, TEDS distinguishes between transfer admissions and initial admissions. Transfer admissions of clients transferred for distinct services within an episode of treatment. Only initial admissions are included in the public use files that you can get from SAMHSA. Other things that you need to note, an asterisk for the pandemic. So as with a lot of the data that is being publicly tracked and reported within the years of the pandemic, access to in-person services was impacted. So keep that in mind in the analysis and communication in your dashboard. Last thing here, TEDS has created variables. So the data set contains several variables created from original variables submitted by the state. So for example, a variable was created to indicate whether a given drug was recorded as the admission's primary, secondary, or tertiary drug of use. So these are flag variables, and they're named as such. So there's alcohol flag, so ALC flag for alcohol, Coke FLG for cocaine flag, etc. So the code book talks about all of these in depth. So you can take a further look at those. So now that we've given some background, hopefully you understand a little bit more about where TEDS comes from, some of the limitations here, and now we can take a look at TEDS data sets and how we would do some processing for these to get them into a format that we can actually leverage. So off of the SAMHSA's Health Data Archive, you can get TEDS data sets. Like, as I mentioned, I think last November 2022, the TEDS A 2020 data set was released. These are public files. You can get them in SAS, SPSS, STATA, R, and then you can also get them in ASCII comma delimited formats. So the format that we usually work with here is the ASCII comma delimited, so that we can use it in any number of different processing pipelines. But if you want it in an R data frame, you just grab the R version of it. So there's also, in addition to these format data sets that have the individual case ID records for all of the admissions in the TEDS A data set, you can also get quick stats. So if you are on the SAMHSA TEDS data website page, you can scroll down a little bit and you'll see this quick stats page here. And so you can choose your state, the year of TEDS that you're interested in, and you can choose admissions or discharge for the type of TEDS data you want, and you can view this kind of summary table of statistics here. So it gives you a nice aggregated view of gender, race, ethnicity, and age, and a breakdown by the primary substance that they were admitted for. And you can get it in CSV and Excel. So this is pretty useful if you're just looking for kind of basic trends before you kind of dig into the data, or maybe depending on what kind of dashboard you're building, this information might be all that you need. But if you want to dig in more and have individual admission record level access and being able to do a lot of cross filtering across those 62 different variables, this is one of the processing workflows that we use. So we start with downloading the files out of the SAM HDA repository. So each year at this point is about 250 megabytes per file. So if you're looking at, say, 2015 through 2020, which we are, it's about a 1.3 gigabytes in files when you grab them. So we download these individual files and then we merge them down to a single file for us. This is just the way we do it. You could leave them in these individuals for the next step, but we just bring them all into one file. And then we take that file and we connect it to our database. So our dashboard system, what we're using to store all of our data in a data warehouse, is a Microsoft SQL server that's hosted in a government Azure cloud. So the Department of Health has a Azure for government instance that they use up there for that. And so we're working with them to store data in that. So we can create a database, or we can use an existing database that we have. And then we have code that will take this file, create a table schema for it, and insert data for it. One of the things that we do is we subset by state. So I think there's about 1.3 billion different records in the 2015 through 2020 TEDS admission data set, if you're looking across the entire United States. So we can subset that down to about 24,000 some records when we go for Hawaii. So inserting that takes significantly less time than processing through 1.3 billion records. The next thing that we do is we create normalized tables. As I mentioned before, those 62 variables, they're all stored basically as integer values in more or less in there. And so those aren't superhuman understandable, and there's no labels related to that within that kind of spreadsheet type format. So we're going to make the tables that are essentially outlined in that code book that map those integer values to those labels. So we'll make these variable tables, and then we run some SQL queries to essentially create a new table that will map these labels to those values. so that we can have a new table that we can leverage in building our dashboard. So in this data processing piece here, we've captured the pieces of code that we use to do this process so that we can share it with other folks, and then we can iterate it on it as well. So we've posted these codes up on GitHub. So these are open to the public, so anyone can access these. So if you're looking at processing TEDS data, this is as good a place as any to start looking, because we have Python codes for combining the files and doing some insertions into MySQL and Microsoft SQL databases. We also have some SQL codes here for creating the different variable tables, as well as doing the conversions of doing that mapping as well. So here we have this TEDS, this load data py does everything from combining multiple CSVs into writing the final CSV file to the database. We also have like the codebook table SQL, which handles creating all of those different tables. And then we have this TEDS conversion SQL, which handles doing that whole mapping back into this, categorized, labeled table. We will be holding some consultation hours over the next, several weeks. So if you're interested, these are the dates and the times for those, and there's a Zoom connection there, so you can just drop in and ask for assistance on, anything related to this or, dashboard stuff in general. Okay, so now that we've talked about processing, we can talk about some dashboard development stuff here. So I'm going to show you some examples here. So this is two different Power BI dashboard examples that Jennifer Geis and our team kind of pulled together. So one here is looking at the primary, secondary, and tertiary substances uses over 2015 to 2020, and then another one is looking at primary substance at admission against race variables. So we'll walk through step by step using Power BI Desktop. So if you're not familiar, Power BI Desktop is a free to install and use on a Windows operating system, low code, no code tool for building reports. We use it to build dashboards. Power BI Pro is sort of the next step in our workflow. This requires a subscription to have this Power BI Pro, but it also allows for sharing across the team, having a shared workspace, as well as being able to publish out these reports or these dashboards. So for the example dashboard we're going to walk through, we want to examine TEDS admission data for Hawaii by doing substance use type. So this primary substance use type by race, and then being able to filter by race, by the substance type, by age, by gender, and admission year. So this is basically what we want to build. So how are we going to do that? So we'll load up our Power BI Desktop, and we're going to load our TEDS data set with it. So the first thing we'll do is when we open it up, if you're familiar with Microsoft Word or Excel, the format's similar in that there's a ribbon at the top that has a lot of your options here. This space here is going to be our canvas, more or less, for putting in our visuals and dragging and dropping those things around and what we're going to see when we get a dashboard. And then there's going to be a section over here that we can select our visuals and data sets with the pane. So we'll get a little bit more into that. But basically, when you open up Power BI Desktop, this is what you'll see first. So you'll click, for us, since we have a Microsoft SQL server that has the process data in it, we'll click this, and we'll get to enter in our server information in a little form. And we'll just import this into our, we can enter in the server information, and then we'll just choose import data instead of doing direct query. Import data brings the data into the report itself. That makes it pretty quick to do filters and queries and things on, versus the direct query stuff. So once we enter in our database information, we're presented with all the different tables that we have in our database. So in our data warehouse, we have a number of different ones here. So we can select a table from this. So the table that we created with that whole data processing pipeline is called TEDS 2020. When we select that, we get a little preview here of what things look like. So you'll notice that the columns here for census state FIPS code versus being a number, is Hawaii education versus being a number, is the actual labels here. So this is our this is our converted table here. So we'll select that table and we'll load it up within Power BI. So now our data set and the model is loaded. So when we do that, Power BI automatically creates its own model. It's basically just kind of like, the spreadsheet model, where all the columns essentially are the different field types, and then all of the rows are the records that are in there. So one thing that shows up after we do that is we get this fields pane here. And then we see that the TEDS-A 2020 data set shows up in there. So if we click on that and we toggle it, all of the fields, so all those 62 different columns are fields that we can access as data for building our dashboard here. So one of the things that we need to do for this data is we need to create a measurement that's basically a calculated field that calculates the number of admissions that are within our whole data set. So for our case here, we want to count all the admission records, and we're going to need to use a field to derive this from. So we're going to use case IDs, so because they're distinct within the TEDS-A data set. So there's a unique case ID for each record, and we can count those distinct case IDs and get the exact number of admissions that are within the data set that we have. So our data set's TEDS-A 2015, 2020 for the state of Hawaii. One of the nice things about this is we create this new measurement field. Whenever we do any filters in the dashboard or within the visualizations themselves, this count updates so that we're able to do these filters by race or substance type or dates and things like that. So this is kind of the only kind of coding step there is in kind of our no code workflow here once we have the data all processed. So when you do this, go to the we went to create our new measurement. Our measurement has a name. We're going to change our name to admissions, and then there's a little code block here for basically doing this count. So if we examine this a little closer, we're going to say admissions is the field that we're making that we're going to call this this new measurement. And basically what we're going to do is we're going to do a distinct count of our TEDS-A 2020 data set by the case ID field. So this will do that count. Another thing that we're adding in here is data suppression. So within all of the dashboards that we develop, the Hawaii Department of Health, they don't want to show any individual record data that has a count less than 11. That's some of the requirements they have. So basically what this code does here is we have a statement that says, if the count here is less than 11, then we'll return 0. Otherwise, we'll just return the count as it is. And that's all this code does, is basically it counts up all of the admission records that we have, and then it does a data suppression if they're less than 11. So now that we've made our new measurement, it shows up here in our model, in our field, so we can use it. So we're going to start building our dashboard here. We're going to create a card here in the upper right corner, which is going to have the count, the total count for all the admissions within the data set. So from 2015 to 2020, all the admissions. So we'll click on in our visualization pane here, we'll click on card, and that'll add a new card placeholder here. And then that brings up some attributes related to a card. So there's a field here. So this is the data that we can add. So we can just drag admissions into this field and it'll add that. A little bit about the visualization pane. So there is, I see there's a question in the chat here. Sorry, I guess I don't know that question. Answer that question right now. Visualization pane. There's basically 3 options in the visualization pane here. So there is this first section that has all of the visuals that are available within Power BI for us to use. So this is adding data to your visual. So you click one of these, it adds a visual, and then these are all the options that you can add data to that visual. This next one here is the one with the paintbrush and the graph here. This is format your visualization. This section here lets us update fonts, text sizes, colors, heights, widths, units, axis labels, and a lot of other information. And then the final one over here with the little magnifying glass, further analysis into your visuals. So some visuals have additional analytics features that can be built in. So drawing constant lines or error bars or things like that. So that's where you can do that. We won't do any of that with the visuals that we're looking at today, but that's just to give you a little reference to the visualization pane that I'm talking about. So we made our card, we drug in our admission data. So you can see this is the full count. So there's 24,703 admissions for Hawaii. And from 2015 to 2020. We can rename our card. So instead of admissions, we'd like to make it number of admissions. So we click the little drop down here and click rename visual and just do that. So next thing we're going to do is we're going to make a little area for the filters. So we said we wanted to be able to filter on age, gender, and year of admission. So we're going to make a little area to do that. So it's just going to be a little visual area that's separate from the other visuals, just to make it clear that this is kind of a different area. So we're going to make a rectangle. So if we go to the ribbon here, we can click insert and shapes, and we just click a rectangle and we'll insert a rectangle. We just get this, we can drag it to where we want, we can resize it. And then under the visualizations pane, there's that format section that I was talking about. You can click format and we can change the color, we can change the transparency of this section so that now we have this area where we're going to stick our filters. So now we're going to add a filter. So we're going to filter by age. So basically we're going to insert a table for this because I want to be able to filter, but I also want to show some of the information about what are the different age groups as well as the different admissions breakdowns for those. So we'll use a table for that. So if you click table, we'll get this placeholder. We can drag it and we can reshape it and size it and put it here in this section that we want for our filters. And then we can drag data in. So for the values, since it's a table, you can have multiple columns. We can drag in multiple fields. So we want the age at admission for our age, and then we're going to want the number of admissions here as well. So we'll drag those two things in here and we'll get two columns. And then we can format this table a little bit. So we can go to our format visual section. We can look at values and we can change the font size to make it a little bigger, to make it a little more readable. We can go ahead and we can also change the values here. So there is kind of a total that was in this last one here, that row that says these are the total values for, say, admissions, which we don't need in our filters. So we can just toggle that on and off. And then we're also going to rename our columns. So right now, age at admission is what it is, and we'd like to rename that age underscore group. So in the same way we did number of admissions on the card, we'll do that. So now we've got our filter here, we can test it out. So if we click on one of these rows, say 35 to 39 years of age for an age group, you can say how many admissions were there in our data set. So now we see that there's 2,659 of those. That's also reflected here in the admissions count within this table. But basically clicking this filtered our card, and that's what we wanted. So now we're going to add a filter for gender. So we can just click on the table button, add another table, drag it in place, drag in gender, drag in admissions fields for the data. And so now we can filter by male and female data here. We can go back into our font visuals and we can reformat this the same way we did the other one. So now we have our two filters there. We're going to add one more filter that's going to be for the admission year. So we have years 2015, 16, 17, 18, 19, and 20 that we want to be able to filter in, so we can look at the years separately. So what we're going to do instead of a table this time is we'll do a bar chart. So we click on the bar chart, we get our little placeholder here. Again, we can drag and reshape. And then since it's a bar chart, it has an X and a Y axis. So for the Y axis, we drag in year of admission as field. And for the X axis, we say, number of admissions. So we drag in a calculated measurement of admissions in there. And then we can go ahead and we can rename year of admissions to admission year so that it shows up here on the Y-axis as admission year. We can turn on data labels. So if you notice in this one here, there's the bar charts, which give us an idea of how many admissions are, but we don't know exactly. So we can toggle on data labels. So if we go to our format visuals here, we can toggle on the data labels by just clicking on or off. So when we turn that on, you'll note that the units are per thousand. So we've got 6.5 thousand for 2015, 1.5 thousand admissions for 2020. So we want to actually report the more granular number of units on that. So we can actually go to our format visuals for the bar chart and go down to values, and we can go to display units, and then we click none. And that gives us, our comma formatted, 6,486 for 2015 instead of 6.5K. All right. Next thing, we have some color schemes that we're trying to conform to in our design. So we can change the bar chart colors by clicking on the format visuals. There's a bar section, and then there's a little color here. You can click and change the default color. You can use any of the ones in the palette here, or you can use more colors like we did and use a hexadecimal color value that we use for a lot of the web stuff. So we have colors within the website that use this value, so we can use that in our bar charts. All right, and then finally, we had the title here, which was auto-generated number of emissions by admission year, which we don't want to clutter up the filters, so we want that gone. So within our format visuals, under the general tab, we can just toggle on and off the title and get rid of it. So now we have all our filters, so we're going to add some visualizations here. So we want to look at the substance, the primary substance use. So substance use primary is the field that we have in our database table, and that maps to sub 1 within the TEDS-A, sort of raw data set that we downloaded. So we'll drag that into the y-axis, and then we'll put emissions again in the x-axis, and that will give us this bar chart for the different substances that we have. And you can see methamphetamine speed across the 5 years that we're looking at is the #1 primary drug for admissions, and then alcohol and marijuana are number 2 and 3, pretty close together. So we kind of repeated the formats that we did for this bar chart over here by changing the color and renaming the axes. So now we're going to do race, and we're going to do a pie chart instead. So we can click pie chart, and we can drag in race into the legend. We can drag an emission into the values, and then we get a nice pie chart here with a nice legend by these things here. The final thing that we're going to do, since we can filter across all of these, so we can click these things and we can click through and click multiples of these to drill down into the data, we want an easy way to reset back to the initial 0 filters. So we're going to make a blank button here, so we can click insert buttons and make a blank one. We can go to the format and change the name on our button, change the size. Then what we're going to do, in order to have this button do something, we're going to need to define an action. And to do that, we need to define a bookmark. So we can go to view and go to bookmarks, add a bookmark. Here, when we add a bookmark, whatever the state of the current view was, so if there's 0 filters, that's the state that happens when we access that bookmark. So you can see we added bookmark 1. We can rename it by clicking the 3 little dots. We get a little rename. So we'll rename this to reset filters. And then we can go back to our button, click it. And then under the button properties and the actions, we can choose bookmark, and we can choose the bookmark that we just made. So now anytime we click this, it'll remove all the filters that we previously had. So that's basically, a super simple dashboard that we have to look at race and substance use and do some filtering by age group, gender, admission year. You can even click on, any of the bars in here and filter the race information or vice versa. So next thing we want to do is publish this. So the way we do that is from Power BI desktop, we save out our report, and then we click publish. We log into our Power BI Pro account, and we choose the workspace that we're going to publish this to, and then it shows up. So this is the UH team workspace. So I published that. The thing, actually Jennifer did this. She published this work. So here's the dashboard within Power BI Pro. You'll notice we're in the Power BI Gov system. In order for us to make this available to the public, all we have to do is go to File, Embed Report, and Publish to Web. That generates a public accessible URL to this dashboard. Also, it generates some iframe code that we can embed in the website. And that's essentially what we do after we vetted all of our dashboards with all the different stakeholders that we need to. Then we go through this process and we embed this in the website that serves out the State of Hawaii Behavioral Health Dashboard. All right. Just wrapping up here, TEDS for Research. Dr. Trina Becker from the University of Hawaii, she's one of the folks also on the OD2A team. She's collaborating with Dr. Connor Flynn and Dr. Alberto Gonzalez Martinez from Chaminade University, and they're doing some machine learning analysis with the TEDS data set for the across the entire US. So they're developing a dashboard in Python Dash to look at specific times for admissions and discharges in different geolocations. So looking at things across states, looking at different categories like gender or any of the other variables that we talked about for the demographics, as well as, generating things like this to compare, admission volume across states, things like that. They're also doing, like I said, machine learning here to do clustering of the different admission records and discharge records to see, if they can tease out some combination of factors that lead to better or worse, outcomes as they're looking at some of these things. So that's some interesting research that folks are actually doing with the TEDS data set. So they'll probably be hopefully publishing and releasing some of this soon. If you want more information on this or are interested, here's their contact information that you can access. And then, so just wrap up again, after this webinar, when you leave Zoom, 3 short questions, yes or no to answer. So if you wouldn't mind taking a moment. Again, we have consultation hours. So our team of data scientists will be available during these 1-hour blocks to talk about dashboard stuff, talk about processing TEDS data and things like that. So you can just access it with the Zoom link here. And we'll also send this information in a follow-up email. So thanks everyone for your time. Appreciate you all coming to the webinar. We're ready to take some additional questions now. We will be emailing out links to the slides as well as the recording in a follow-up email. So any questions here? Do you have to take secondary suppression to prevent back calculation? So is that related to the data suppression that we're doing for the less than 11 in your question, Anna?
Hi, yes. So here at Washington State DOH, we suppress any cell values less than 10, but then we also apply secondary suppression after doing that. So for example, if someone's looking at race ethnicity groups within a single county and one of those groups is suppressed, but the others are not, then they could theoretically take the county totals, subtract the unsuppressed groups and back calculate the suppressed group. So I'm always curious if other groups are employing secondary suppression, and if they do, if they're able to do it within Power BI. It can get pretty complicated though.
So we haven't looked at some of that secondary suppression yet. A lot of the data that we're dealing with is well, in the TEDS data set, this is all public anyway, but we're most of the information that we have, we look at the information that we're providing, and they couldn't, even if they got an individual record, for the most part, couldn't back identify an individual. But we're doing the suppression anyway, just to be on the safer side. But I take your point that if you slice it enough different ways, you might be able to take the totals and back calculate. So yeah, we don't have anything. If you have ideas, you'd be interested to hear what you do for that.
Yeah, happy to talk more about it. Thank you.
Okay, yeah. And then I would recommend using Slicer for filtered decomposition visuals and creating a new measurement for year-to-date admissions.
Hi, I'm Gan. I was just interested in knowing how many admissions were there till 2018. So that's why I wrote creating a new measure to calculate year to date admissions, because I'm interested suppose in 2017. And the other thing was adding a slicer would do the things easier. I think if somebody wants to know for year suppose 2018 or 2019 how many admissions were there, they can just go into this slicer rather than on the visuals that you are clicking on right now on 2018. And then of course all of these categories can be streamlined in decomposition visuals. So those are the recommendations.
Okay, yeah, that's interesting. Yeah, this is one of the visuals that we've come up with here for allowing folks to explore and drill down into the information. So yeah, we could look at looking at the slicers and the decomposition for other ways to present the information as well. Okay.
One more question. Sorry, can you go back to the?
Sure.
Yeah. What does the in the primary substance visual? What does the gray green line mean? The total number is 1388, and what is the?
Oh, this.
Yeah.
So this the lighter line, that's the total out of for the entire data set.
Okay.
So for across all 5 years, our total here is, out of for 2018, methamphetamine as primary substance emissions is 1,388, and the total emissions for 2015 through 2020 that had methamphetamine as primary is 10,212. So you can compare the two. Any other questions or comments? Okay, well, if not, then I think we're about 3 or 4 minutes to the end of our hour. So folks are free to leave, free to contact us at itsci@hawaii.edu if you have questions or anything for follow-up. And as I mentioned before, we will send out information about these 1 hour blocks where you can just drop in on Zoom and chat about these things.